Good morning from Jonesboro, Arkansas, 9:30 a.m. Well, what's the date? The 5th of December, 2023. I want to talk today about something off topic of electric cars. I need a root canal. And they could not get me in to the specialist for almost 2 months because evidently doing a root canal in a back tooth is much more difficult than any other the teeth up front. So my dentist does not do them. This second time I've needed a root canal in the back. She always sends me to a specialist. And I don't know if that's normal or just her. I didn't want to question her because I was afraid she would take it wrong. But I was just curious, I wanted to know, but anyway. Here's what you need to do. If you're going to see a dentist and you're on antibiotics, you need to let them know. Because when I went to see her for my checkup, I was on antibiotics, didn't tell her, didn't think about it, she didn't ask, and I had a cavity. And so anyway, they scheduled me to have that fixed a few days later. And when I went in, a different dentist seen me, and she said that I'm thinking this may be too deep. Evidently the stuff they put in your tooth for the filling, if it's too deep, then it will not cure. She said, I'm going to try, but I'm not sure it's going to work. We're going to try layering it. When I told a friend of mine about this, he said, well, can't they layer it? I said, they tried that. I'm not exactly sure what that means, but I can kind of use my imagination and maybe figure it out. But anyway, it didn't work. And so then she said, well, we're going to have to just get a crown. And of course, when the first person I told after the appointment, and she went ahead and she said, I've got time. She went ahead and prepped me for the crown and put a temporary on. First person I told, they're like, well, isn't that convenient? Isn't that convenient that it just happened to be too deep? And so now she wants more money for a crown. Ho, 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 ho. In other words, the dentist lied to me. The dentist committed fraud. The dentist is putting a little bit more profit, if it's even more profit, over the health of her patient. In other words, she's a scummy person without any evidence whatsoever. It's amazing how many people think everybody you meet in your life, every professional, every doctor, every nurse, every dentist, every lawyer. Okay, for lawyers it's true. I'm just kidding. But everybody you meet is trying to rip you off. They don't care. Doctors, they don't care about your health. All they want to do is get their money. Same with dentists, same with everybody. I don't feel that way. Maybe I'm just gullible, but I never do that. Without evidence, I never jump to those conclusions. So anyway, she put the crown on. The regular crown came in. I put it on, but then I had all kinds of pain on the left side of my face. Horrible, horrible pain. I Googled it, and Dr. Google said I had 6 months to live. So anyway, just kidding. Well, sort of. I could have had a tumor. Could have been the first signs of MS. It could have been some type of rare disease that makes the left side of your face hurt. Could have been the first signs of Bell palsy, which I've had before. Could have been a stroke. Could be dental problem. Since it was the whole left side of my face and it tingled and hurt, I didn't think it was a dental problem. But I went and saw my dentist anyway. And sure enough, she did an x-ray and found out that tooth that they just put the crown on, it had problems. It needed a root canal. And she asked me, she said, you been on antibiotics lately? I said, yeah, I was on antibiotics when I came in to see you. I was just getting over an illness. She said, yep, I think that hid the problem because this is not what your x-ray looked like the day you were here, just a couple weeks earlier. She said, your x-ray didn't look like this. And so anyway, all that was for nothing. Filling the cavity was for nothing. The root canal was for nothing. I mean, not the root canal. The crown's for nothing. I've still got to go get a root canal. I sat in that chair that day almost 3 hours. Counting the cavity and getting me ready for a crown. It was all for nothing. It really sucks. But anyway, it wasn't her fault. But again, I guarantee you, there's going to be people that's going to say, yeah, she just wants more money. Now, at least I don't have to buy another crown because it's warranted for a year. And so I won't have to do that. But anyway, if you're on antibiotics, make sure you tell your dentist. And she put me on antibiotics again because it was hurting so bad. They gave me some Tylenol 3. And she said, when's the last time you had an antibiotic? And I looked it up. This is a few days later on the phone. I looked it up on my Apple Health app because I keep up with all the medicines I take on my Apple Health app. And I told her the date. She's okay. I'm going to send you a prescription for more antibiotics. She did that, and it completely wiped out all the problems I had on the left side of my face. Completely gone. Within a couple of days, those antibiotics worked miracle. I don't have any more pain. But the antibiotics ran out about 4 days ago, and I'm starting to feel it coming back slowly. And I still can't get it fixed until January 11th, 12th, something like that. And the specialist is just so booked up. So if you have children that don't know what they want to do with their life, tell them to be a dentist or a dentist specialist, one that can do root canals on the back of the tooth, so people don't have to wait as long. And plus, they can rip people off and tell them they need a crown when they actually only need a cavity. I don't know anything about running a dentist office. You know, people who jump to those conclusions that they just wanted more money, is it really more money? Is it really more profit? Maybe, you know, because she's always got a full schedule. I'm shocked she could do my crown that day. Because usually if it's just a cavity, they don't have time to do. They have to schedule it later. So she could have been working on somebody else besides me and got the same amount of money, I would think. And is there more profit margin in a crown than there is in a cavity? Probably. And, you know, when I like to ask people who tell me those things, I'm like, so if you were a dentist, you would have done that? And they're like, no, I wouldn't have done it. I said, so you're the only person. You're the only person that could have been an honest dentist. All the other dentists are rip-off artists, if that's who they're accusing. You know, and they're like, well, you know, not all of them, but most of them, yeah. You know, but you're different. And they wouldn't have people suffer just for more money, your average person. And that includes dentists, doctors, and everybody else. You can believe it, not believe it, whatever. But the main thing is, let your doctor know if you're on antibiotics, your dentist. It's very important. Something I learned. 57 years old, I'm still learning stuff. All right.